Good afternoon. I call this business meeting to order. Today we're going to consider three bills: 2953, the Indian Health Service Accountability Act of 2016, S3234, the Indian Community Economic Enhancement Act of 2016, and S3261, the Native American Business Incubators Program Act. I introduced S2953 along with Senator John Thune. In May of 2016, Senators McCain and Rounds have joined as co-sponsors. On June 17th of this year, the committee held a hearing in Rapid City, South Dakota. This bill is a critical first step on the road to reform because it targets the core of dysfunction within the Indian Health Service. I intend to offer a substitute amendment, which is based on feedback from the Department of Health and Human Services, the Indian Health Service, and the Office of the Inspector General, as well as the Government Accountability Act, Indian tribes, and tribal health organizations. This bill is the outcome of months of committee investigation, the oversight hearing and listening session in February, the 2010 Dorgan report, and countless emails, phone calls, and meetings with stakeholders. There is no question that in delivering health care services, the patient is the priority, not job security. It's undeniable that the Indian Health Service needs employees to deliver health care services, and there are many dedicated ones working for the agency. The Indian Health Service also needs the tools to deal appropriately with bad employees and reward the exemplary ones. There should be a balance between employee rights and accountability. As a doctor, I'm deeply troubled that there is currently an imbalance which has been affecting the service delivery to patients. We're trying to correct this imbalance with this bill. We're also working to ensure the funding is spent correctly. The Indian Health Service funding has increased by 43% since 2008. During the course of our review, we found out that significant sums were spent on unrelated expenses, such as interior decorating, not patient care. We must ensure that the agency can appropriately manage its funds and the spending is in the best interest of the patients. Any surplus should be used for certain core functions of Indian health care delivery. The substitute amendment is intended to strengthen these accountability and transparency requirements for the Indian Health Service. The substitute amendment, which also requires the Indian Health Service to work with Indian tribes in developing a meaningful policy on tribal consultation. I want to thank all of those who helped in making this bill stronger, and I'm pleased during our hearing in South Dakota that the Department of Health and Human Services has come out in support of the bill. I want to keep working with Senator Tester and the rest of the committee to continue improving the Indian health care system. This bill has the potential to save lives, so we need to work together to get this bill through Congress and send it to the President. On July 14th of 2016, I introduced S3234, the Indian Community and Economic Enhancement Act of 2016, with Senator McCain. I have a substitute amendment to be offered on this bill. The committee held a legislative hearing on the bill on September 7th. This bill is the product of several committee hearings, roundtables, and listening sessions on Indian country needs. The bill is intended to address access to capital and provide tools to build and promote Indian-owned businesses in Indian communities. The substitute amendment would add a number of technical and clarifying refinements to the bill. It would provide more agency accountability under the Buy Indian Act and in coordinating and developing initiatives to help Indian businesses. It would add a Government Accountability Office study on the federal capitalization programs available for Indian tribes and businesses, the barriers in accessing these programs, and recommendations for addressing the barriers. The amendment requires that not less than 50% of the total social and economic development funding be used for the economic development grant priorities under the Native American Programs Act. I look forward to moving this bill expeditiously through Congress as well. On July 14th of 2016, Vice Chairman Senator John Tester introduced S3261, the Native American Business Incubators Program Act, along with Senators Cantwell and Udall. Senator Murkowski also joined as a co-sponsor. This bill develops a program to develop Native businesses and entrepreneurs. The committee held a hearing on September 7th. I have a couple of concerns with the bill. One, that this bill appears to have similar goals as the Small Business Administration and the Minority Business Development Agency, and of course the cost associated with the bill. I understand the intent of the bill is to kickstart that entrepreneurship, which is absolutely needed. I'm a big fan of programs that refer to return on investment. I hope we're not creating a new program that the administration will not take seriously. My concerns are not enough to stop this bill's progress, and I look forward to continue to work with you, Mr. Vice Chairman, on our shared economic development legislation. Before we turn to the bills, I want to ask the Vice Chairman if he has an opening statement.
Yeah, I do, and thank you, Chairman Barrasso, for holding this business meeting, and just be assured that as any of the bills that come through this committee move forward, that we're more than open to work to make the bills better. Two of the bills that we're voting on today address economic development. We often hear about levels of poverty and unemployment in Indian country. So it's a good deal that we're moving these bills forward that will help tribal communities build their economies and spur entrepreneurship. The first bill I want to talk about is my bill, S 3261, which would provide economic development in Indian country by establishing business incubators directly in tribal communities, and that's important. Tribes in my state shouldn't have to send their entrepreneurs to Missoula or Billings to get training, so that's why my bill prioritizes incubators that would be established in places like Lame Deer, Wolf Point, or others. Additionally, the knowledge and technical assistance provided by these incubators would come from entities who know how to be successful in tribal communities. Too often, we devise federal programs that aren't tailored to the unique challenges and the needs of Indian country. That is why S 3261 empowers tribal entities who know the business landscape in their communities to help local entrepreneurs succeed. I know some of my colleagues may be concerned about duplication across other agencies, and we certainly don't want duplication, and I don't think S 3261 does that. I don't know of any existing program that takes Indian country business expertise and applies that directly back into those tribal communities. But if I can achieve a goal of potentially making this bill work better, I would be happy to work with them to make sure these programs work and work for Indian country. And I'm also happy to work with the chairman on his bill, 3234, to clean up some of the existing programs promoting economic development. We do not need to get the Department of Commerce more engaged in tribal communities, and strengthening the Buy Indian Act would open up even more contracting opportunities for tribes and entrepreneurs, which means more jobs in Indian country. So I'm glad to see the provisions in S 3234. And I encourage my colleagues to vote yes on both of these bills. Now I want to get to S 2953, the IHS Accountability Act. We've heard a laundry list of issues at IHS, and every one of us on this committee can admit that there are problems at that agency. But this bill does not get to where we need to go. Instead of providing managers the tools and the trainings needed to identify and deal with bad actors, it addresses the tail end of the disciplinary process by limiting appeal rights of employees, and it does it in a way that has constitutional and due process concerns. We've seen provisions in the VA context, and they won't work. Shortcutting appeals doesn't actually address the issue of bad actors being ignored or passed around from one facility to another. If anything, these provisions would make IHS a less attractive employment option, and we need to be doing exactly the opposite of that. Now, there are provisions in this bill that I like. The chairman's bill encourages professionals to volunteer in tribal communities by streamlining credentialing process and extending liability protection. This bill also recognizes the lack of housing that deters health professionals from working in Indian country, and it would require the IHS to modernize how it determines the staffing needs to serve Native Americans. But there are things that we've heard from Indian country that this bill doesn't address. It doesn't do much to improve the access to quality care. It doesn't increase scholarships or loan payments to help recruitment. It doesn't do anything for the urban health care, and it doesn't do anything to address the severe funding needs in IHS right now. I know some of my colleagues don't agree that this is a funding issue, but the fact is Native American health care is about $3,000 per patient, which is half of what we pay for veterans care and even less than other health care systems. We're simply not delivering on our trust obligation. Now, I don't think this bill is the right solution for problems at IHS, and I know it doesn't address the issues that I've heard from tribal leaders across Montana. And that's why I have put together a comprehensive draft, which I'm going to be sharing soon to get more feedback from tribes and to my fellow senators on this committee. My staff has already had preliminary discussions with tribal leaders and health officials of Montana. I hope to get feedback from a broader audience to make sure that any changes proposed to IHS will work for all of Indian countries. And for that reason, I regrettably am going to have to vote no on 2953, knowing well that we have to make some changes in the process, but also knowing that this isn't the right bill to do that yet. But I look forward to working with the chairman and anybody on this committee to make this happen. Bottom line is, we do need to get rid of the driftwood and agencies, but we have to do it right.
Thank you, Senator Tesser. Would any other senators like to make a statement? Senator Murkowski.
Mr. Chairman, I will submit a full statement for the record, but I just want to thank you and the Ranking Member Tester. I think our committee has done some good work this past year. I think we have not shied away from the difficult issues, whether they relate to the health and well-being of Native children, or how we deal with domestic violence, drug and alcohol abuse, dealing with the IHS system, these economic development bills that we have in front of us today. There has been a great deal of engagement. We've had a lot of hearings. I know that there have been a fair number of field hearings and just a real reach out on these issues. And so I thank you for that. I take your comment, Senator Tester, about the incubator bill to heart. I am a co-sponsor of that. This is an issue where in so many of our very remote, very rural communities, I am constantly asked by people, what more can we do to be a bigger participant in bringing a larger economy to very challenged communities. And so the notion of how we deal with some of these incubators is something that we want to try to get right, but I also know that a bigger bureaucracy is not what these people need. What comes to mind is a meeting that I had, chance meeting with a young woman whose business was making kuspuks, which is the traditional native garb, and her business was sew Yupik, S-E-W, Yupik. And here she is, a young woman trying to get started, and you think about the ultimate incubator, sitting there over your sewing machine and trying to figure out how you're going to shop these over the internet. And so I want to work with you to make sure that we do this right, and I thank you for your efforts with it. But thank you, Mr. Chairman, for all that you have done in the leadership of this committee over this past year.
Thank you, Senator Murkowski. Anyone else like to make an opening statement? Senator Daines.
Thank you, Mr. Chairman, Ranking Member Tester. During the July and August work periods when we were back in our states, I had the opportunity to meet with a number of Montana's tribal communities. In fact, I got to nearly every reservation in Montana. And the consensus was pretty clear. The Indian Health Service is in disrepair. It's in desperate need of reform. I think all of us would agree with that. The Missoulian recently covered, the Missoulian's a paper from Missoula, Montana, recently covered the devastating state of the IHS in a 4-part series. In fact, one of the words a Montana tribal leader used to describe Indian Health Service in that report was called genocidal. We've heard the tragic stories that resulted from IHS negligence and the lack of care for far too long. That's why I am a co-sponsor of Chairman Barrasso's Indian Health Service Accountability Act. This legislation, I believe, makes modest yet meaningful changes to the IHS bureaucracy. It allows for the hiring of qualified employees, for the firing of those who aren't qualified, and to protect current employees who report malfeasance from retaliation. Chairman Barrasso, thanks for your leadership on this, and I'll be voting yes.
Well, and thank you, Senator Daines, for joining as a co-sponsor. Senator Langford.
Yeah, I want to be able to just thank also the chairman and vice chairman for the work on this and for the cooperation together on it. Last May, I held a field hearing in Anadarko talking about economic development in Indian country, specifically some of the unique issues in Oklahoma and economic development there. A lot of great questions, comments, talk about SBA, talking about the 8A programs, all the issues that are there. They clearly articulated some of the areas where it needs work. But part of my concern on 3261 is the responsibility that already lies with minority business development agencies, SBA, the Administration for Native Americans, BIA, Department of Commerce, all have a piece of responsibility here. And my concern is they're not getting the job done, so adding another one. So I would love to be able to work with the vice chairman to say, if there's a new entity that can get the job done, let's dig into it. But when we turn that one on, let's turn these off at the same time, and to make sure that we've got clear lanes of responsibility, because there are 5 other entities that have some responsibility. They're not getting it done. Let's try to make sure that we've got one and they get it done well. So I'll have to vote no on this one, but I look forward to getting a chance to talk about this, and so we can figure out how to be able to get this done. So I thank both of you for your work on all these things.
Any other members requesting to be heard? Hearing none, will now take up S-2953, the Indian Health Service Accountability Act of 2016. I'd like to take a moment to briefly address some of the concerns raised by the Vice Chairman. This committee has continue to hear about the problems at the IHS. We address in this bill. We've heard about them since 2010, and nothing has been done. The issue being raised involves the constitutionality of provisions in the bill that are similar to the removal provisions in the VA reform law, which has been challenged in federal court. We've worked closely with the Congressional Research Service, the Senate Legislative Council, and other legal experts to consider the constitutionality of this bill. In fact, CRS and the Senate Legislative Council assisted staff in drafting of this bill to strengthen the due process protection of the Indian Health Service employees. This bill is distinguishable from the VA reform law. We have different timelines for notice and for appeal. In addition, the bill requires administrative law judges who are presidential appointees involved in the administrative appeal. If challenged, I'm confident this bill will be upheld, so I encourage every member of the committee to support reform that we know is so badly needed. And with that, I move to consider the substitute amendment AEG 16384. Is there a second? Any discussion? Hearing none, all those in favor, please signify by saying aye. Aye. Opposed, signify by saying no. No. In the opinion of the chair, the amendment passes. Now move to consider S 2953 as amended. Is there a second?
Second.
Discussion? Being no further discussion, all those in favor signify by saying aye. Aye. Any opposed?
No.
In the opinion of the chair, the bill as amendment passes. Next, we'll take up the Indian Community Economic Enhancement Act, S 3234. I filed two substitute amendments. BOM 16574 is withdrawn. File another amendment, BOM 16579, yesterday. In accordance with our committee rules, I ask the Vice Chairman for his concurrence on waiving the 48-hour rule.
Yes, thank you.
Thank you, Mr. Vice Chairman. I now move to consider the substitute amendment, BOM 16579. Is there a second?
Second.
Any discussion? Hearing none, all those in favor, please signify by saying aye. Aye. Opposed, nay. In the opinion of the chair, the amendment passes. Now move to consideration of the bill as amended. Do I have a second? Second. Any discussion? Hearing none, all those in favor, please signify by saying aye. Aye. Opposed, no. The bill as amended passes. Next, the Native American Business Incubators Program Act will now take up S 3261. Is there a motion to consider S 3261?
So moved.
Is there a second?
Second.
Any discussion? Hearing none, all those in favor, please signify by saying aye. Aye. Opposed, nay. In the opinion of the chair, the bill passes. I want to thank the members of the committee for getting the business done in an expeditious manner today. I ask unanimous consent that staff be allowed to make technical and conforming changes. Being no objections or further business before the committee, the meeting is adjourned.